Was it 2 years ago? Yes, it was the January of 2 years ago. You already knew about regenerative medicine, and I was surprised that you had learned it by yourself. But you didn't know about stem cell therapy, right? No, it was the first time I heard about that. Then I was told that it would be good for meniscus tear. I had been suffered by it throughout my career. It was covered up by muscle and other factors to some extent. But when muscle became weak with age, I often had swelling or water on my knee. That was when I sought a consultation with you. How many times did you take PRP therapy at that time? About 3 times. How long did the effect last? Over a month. I received the therapy during the season, so I didn't take injections many times in a short period of time. I could just receive it when the opportunity came. This time, you received monthly stem cell injections 3 times. How did the symptom recover? Was it gradual change compared to PRP therapy? Yes, I talked with my teammates when I received the first injection, but the outcomes felt slow. That's what everybody says. It somehow felt stabilized after a certain period of time. After the 3rd injection, were you satisfied with the outcomes? Yes. In the next season, swelling and other symptoms almost disappeared. You did muscle training well after recovery. I think it had a great effect. Your leg had become thin when I saw it the first time, but it recovered. That doesn't just end with injections. I had many things to make efforts by myself. Artificial joints or any other surgeries require muscle training and stretching. I took the balance naturally, then I could participate in the latter half of the league competition last year. Could you play the full 90 minutes in the match? Yes, I sometimes had a pain in the match where the cartilage was damaged, but not so much as requiring a rest. It is still usual that we recommend patients with knee pain to receive a surgery for an artificial joint. But once I introduce regenerative medicine, they see many possibilities in it, though it's at their own expense. After they receive actual treatments, some are recovered without surgery, others require surgery, but they're satisfied with that. That's why I think knowing many options means a lot. I also hope that such people know about this. Half of athletes are forced to retire due to injuries. Injuries become a trigger for their retirement. Yes, that happens very often. I hope that as many options as possible become available. Once it becomes popular, it's easier to find. Doctors will also offer various options one after another. As the medical technology develops, the average age of players has been rising. For younger players as well, the overall environment is better now. Thanks to this, more young and promising players have been emerging. If regenerative medicine was available when you had anterior cruciate ligament injury, you might have recovered faster. I was also surprised when I learned about this kind of therapy. The development of the therapy will be beneficial for everyone playing sports. It was around 2013. I had a stress fracture of the tibia, which took 2 months to recover. It was followed by a dislocation of the shoulder and surgery. These were my first severe injuries. In the off-season practice match in Guam, I had right anterior cruciate ligament injury, which took a year to recover. I was forced to come back to Japan and officially diagnosed as the injury. The doctor encouraged me to recover before the Emperor's Cup. But I despaired because it was still the preseason in February. The Emperor's Cup is held around December. The single injury in the training hindered me to play the rest of the year. There are no guarantees in the athlete's world. I felt like hitting rock bottom in an instant. I started with the training to walk for the first month or 2. I was told that moving within 3 months would increase the risk of recurrence, so I just hoped that the 3 months would go by faster. I had anxieties, but I could join in the middle of the game. It was impressive that I received applause from the stands. I realized that people were waiting for me to come back. I felt that moment was special and irreplaceable. I was 32 years old when I had the knee injury, so I thought that I had to stop playing if the injury would recur. I was frightened by the risk of recurrence. Removing natural thing is not good for human body. That was my initial thought, so I wanted to avoid surgeries. I found regenerative medicine as a way to recover without surgery. Surgery requires to leave from playing for a certain period of time, but PRP therapy just mitigates the pain. I chose to receive the PRP therapy and keep playing. Recently, Shohei Ohtani, the baseball player, took PRP therapy for his elbow, and it was reported in the media. Now I think less people consider that the therapy is risky. The year after the therapy, I could play without any injury throughout the year. It improves the efficacy. Each treatment method should have its own advantages. We hope to know their advantages and choose one that is suitable. The question is how much one wants to invest in one's own body. Something valuable is always costly. People will act and pay for it when they understand the benefits well. I think paying the price leads to readiness for receiving the therapy. Perhaps the therapy is not enough for recovery, but people will change their daily behaviors as well.